Can you give us a specific example of the interventions that have successfully been implemented in Utah?
Certainly. I already mentioned two of them. The Lion's Quest Skills for Adolescents is a program we offer in our elementary schools. Another intervention is the life skills training that I mentioned, offered in 7th, 8th, and 9th grade. And then we also partnered those things with a family program called Guiding Good Choices. We feel it's very important to make sure that the home is being able to reinforce what the students are receiving in school. A couple other things that we do outside of specific programming is we had a positive community norming campaign that was widespread here in Tooele County for 3 years. And we had a large youth group as part of that. They were out and about letting folks know that the perception was incorrect for what the data said. We had a large perception that everybody here in Tooele drank underage, and we were able to utilize some statistics and let them know that that was not the case.
Thank you. Dr. Haggerty, it looks like the next question is for you. Can you explain how communities choose programs based on risk and protective factors?
Sure. Communities really take a look at a risk profile, and these are the risk factors you see in front of you. And using a validated instrument, the Communities That Care Youth Survey, communities work together to use that data to see where they're elevated in risk. So, for example, if favorable attitudes toward involvement in the problem behavior you see here, you can see that it increases the risks for substance abuse, delinquency, and violence. That might be an example of where life skills training or Lion's Quest would be an appropriate intervention. So communities use the data and their profile, both on risk and protection, and they also use a resource assessment to look at the gaps in the community that they should address to make sure they're addressing their risk and their protective factors.
Thank you. Dr. Coe, it looks like the next question is for you. Where does Communities That Care fit into the SAMHSA Center for Substance Abuse Prevention portfolio?
Well, first I want to point out that our entire department is very committed to addressing behavioral health issues and substance abuse issues. And in fact, we have a cross-department behavioral health coordinating committee that I co-chair with Pam Hyde, who's the administrator for SAMHSA. And so we work closely with the whole department on these issues on a regular basis, and we're very, very proud of that. We are, in particular, very pleased to work with the SAMHSA Center for Substance Abuse Prevention because they're trying to disseminate evidence-based interventions such as what we're talking about today. And the SAMHSA Center for Substance Abuse Prevention has a strategic prevention framework, which is a planning process to guide communities who want to implement effective evidence-based interventions that are culturally appropriate and sustainable. So the Communities That Care model is one of the planning models that are an option for communities that are looking into this process. And as you heard from our presenters, it's very important to assess readiness of your community and build a coalition, pick an intervention that has some evidence behind it, implement it, and evaluate it. And that's the type of process that we want to encourage others across the country to adopt. Because every community is different and every culture is different, if you will. So getting that right mix of evidence-based programs and policies and practices to fit your needs is absolutely essential.
Thank you. Ms. Sagers, the next question is for you, and it focuses on implementation of your program. Who are some of the important individuals or organizations to engage as program champions? And as a follow-up, what strategies and messages are effective in recruiting those individuals?
Thank you. I think one of the biggest champions to elicit for this particular support system is your superintendent of your schools or whatever kind of leadership you have established there. You really want to be able to capture, your audience in a setting that's going to be consistent. And so obviously school program implementation works very well to achieve that goal. When you have the highest person in that administration standing behind this program, supporting the efforts that you're putting out there, it really drives a message that this is worthwhile. And it also helps, at times there's some pushback from the educators that are implementing this in their programs, due to time restrictions and so on. So to know that their boss is telling them, hey, this is important and we need to do it is highly beneficial. What was the second part of that question, please?
what strategies or messages are effective in recruiting these individuals?
I think making sure that you have all of your data current and accurate when you go to talk to these folks so that you can show that there's a real need for this sort of thing. So you need to show this need, but then you need to have great education and some depth on what the program curriculum contains so that you're able to match those needs with some solutions.
Great. Dr. Haggerty, the next question is for you. Is there a version of the program like Life Skills geared to the college student population?
You know, not necessarily Life Skills, but there is a program called Basics, which is a evidence-based program that helps college-age students with issues related to drug and alcohol use. So Basics is it's not specifically Life Skills training, but it's a similar type program that's used for college-age students.
Hi, this is Sarah Wattenberg. The Basics program is one of those programs that is actually being evaluated through a Dartmouth-led program. Dartmouth, Dr. Jim Kim started a learning collaborative involving the college presidents about 18 months ago, and they are looking across the board at evidence-based practices related to curbing the drinking and binge drinking on college campuses, and they've had a lot of uptake on this and are supported also through the work of the College Presidents Work Group over at the National Institute on Alcohol and Alcoholism, NIAAA. And so Basics is one of those ones that these college presidents are sort of looking at, and they're coming up with intervention strategies, going out to their colleges, testing them, coming back, doing evaluations, tweaking the interventions, and Basics is certainly one of the ones that everybody calls out. And I know that along with many other evidence-based practices are being tested, and so hopefully the college campuses in the next year or so will be hearing about sort of the dissemination and diffusion of the practices that that learning collaborative is working on.
Thank you. Ms. Sager, another question for you. Once stakeholders were engaged in communities that care, how were they involved in the implementation of each program?
Thank you. Yeah, once we were able to get these stakeholders all on board and we were able to train them some in the CTC process and get them some education, they then were joined, well, first off, they were able to sort of choose who they wanted to be on our coalition or our board. Therefore, they had representation that served their best interest. Then at that point, after we were able to train some of those coalition members, we all came together in a large group. And once we had the data established and chose our priority factors, both on the risk end and the protective end, they were able to come together and look through that menu set, look at the programs. We were able to get some samples of some of the curriculum and really have the opportunity to become educated on what we're going to be teaching our youth and where the program's going to match what our desired outcomes were.
Dr. Coe, another question for you. What is the ultimate value of using a prevention planning model like the one demonstrated here?
Well, it's absolutely critical to take our good intentions about prevention and use our energies the right way to get really impressive results like we're sharing here today. And so what the SAMHSA Center for Substance Abuse Prevention has done has put together some strategic prevention frameworks, of which Communities That Care is one, so that motivated leaders around the country can start with proven models that work and then try to apply that to their own communities. So for those of you who are on the webinar who want to do more, I'm sure you will have your own ideas of what might work, but it's also helpful to review the literature and also these frameworks that have been shown to work and have effectiveness, and then choose one that's data-driven and strategic and apply it to your own community. And we're hopeful that the more that we can do this as a nation, the more improved outcomes that we can see in our Healthy People data.